community saw that the healthcare needs weren't being met for its people. So in 2004, volunteers got together and put in an application to become a federally qualified health center. Our vision for the Community Health Center is really that all people have optimal physical, mental, and spiritual health on the island of Molokai. We have primary health care, which is like your family doctor. We also have the island's only pediatrician, and he's also internal medicine. We have a nurse practitioner, the only nurse practitioner on the island also. We have dental services, we have behavioral health services, and we have family support services.
We have 20 full-time employees, 5 part-time, and 5 contracted employees. Of that total of 30, 29 are full-time or part-time residents of Molokai.
What's really different about our organization is that it's all about the community, and it's board-driven. The board is my boss.
We're not owned by a health system. We're not owned by a private physician. We're actually owned by the people of Molokai, and that's our sole reason for existing.
Primarily, this clinic is for the underserved community, which is a big portion of Molokai.
There are a lot of people without insurance on this island.
Any age, any kind of person, any kind of insurance or no insurance, doesn't matter. We will see anyone here. We do expect that everyone will pay according to her or his ability. You know, for people with insurance, that's no problem. We have a sliding fee scale if people don't have insurance, and at the same time, we provide quality care. Just because we are the safety net doesn't mean that we won't offer you the same kind of care you'll get in a private physician's office.
We know that the Western model of care isn't working. We know that we've got to do something different if we want our community to access the care. We have to reach out to our community and ask the community what meets their needs.
Growing up here on Molokai, we've learned everything is ohana or family. You treat each other with respect. You offer help in any way possible that you can give. And I think in relations with the Molokai Community Health Center, we kind of supply the same thing. We offer as much help as we can, medically, physically, spiritually.
We are delivering services, health services in a different way. Our goal is to be anchored in our cultural values.
My children are very comfortable coming here. I have a daughter and 4 sons that all come and see the doctor and the staff here, and there's just an unparalleled level of aloha that permeates through the care that they're giving.
By 2007, we had grown to the extent that we were out of space. We'd joke about having to do the Molokai slide as we went past each other.
Space, that's the biggest thing.
So presently, we're operating out of 3 separate buildings. This move would allow us to be more fully integrated in terms of our services, both direct services and support services.
We have outgrown our space, and if we're going to meet the basic needs for this community, we have to expand. The main registration for the entire campus. We'll have one electronic health records that will connect everybody together. Right here, our partner will run a healthy juice bar and eatery. This building will be a non-denominational chapel, meditation room, and our employee lounge. So over here will be our medical building. Behavioral health services will be over in a small building, a pediatric clinic, physical therapy and chiropractor. Over here will be dental services, and then we'll also have family support. On the top building, we'll have room for traveling physicians, and on the bottom will be administration. And it's really about providing integrated, holistic care for the people of Molokai. Western, Eastern, traditional, non-traditional, in a non-threatening Molokai-style way.
Being able to offer a full range of services all in one place, as we're going to be able to do, from the dental to the health, to the clinical, to the behavioral health, to physical therapy and other services. It's really a one-stop shop for not just with being sick, but being healthy.
The importance is that we would be able to know the needs of the person and recognize that it's not just within mental health or not just medical, but it's a holistic approach, that this person desires a greater quality of life, and we want to support that, and we'd be better off supporting that by working together.
It isn't just going from office to office to office to office. There will be navigators to help people navigate those services, to help make sure that they have the right insurance, that they're accessing the right social services, that we can use our health center really to drive the health of Molokai.
Molokai is a very rural, medically underserved area, and we are designated by the federal government as a health professional shortage area. So we're a community that has a lot of medical needs, and we don't have enough providers right now to fulfill those needs. And so that's where someplace like the Community Health Center comes in and fills that important gap area.
So I say we complement. We're not in the business of trying to take other people's patients. We're in the business of serving the people of Molokai.
We're not here to compete with other providers. We're here to ensure that the health of the community can sustain itself. And so part of the vision of the Community Health Center is to work in partnership with all the different providers here.
The reality is now, it's happening, and we're asking all our funders, all the people we have, applied to grants for, everybody to please come on board.
We're a disadvantaged community. We need funders to support us, to help us along the way.
It's really helping people improve their lives, have a greater quality of life, have a greater sense of purpose, meaning, to overcome these challenges such as unemployment, such as health issues, such as trying to find a sense of direction and greater quality of life. I think that's pretty major in terms of knowing where is this funding going to, how is it helping people. I think the great needs here and the use of the Community Health Center is pretty vital in that sense.
Imagine if you had a place where you could go to just feel good, to be around health, to be around your community, to be around the water, the land, all in one place. I think that's the vision, and that's where we're looking at with this project.